Because there are so many wired connections to pain, changing the physical source isn't always enough. So when we encounter useful pain signals, it looks like this. So the hand on a hot pan leads to tissue damage, leads to spinal cord reflex. Right? So spinal cord going up to the brain, and withdrawal reflex from heat source activates the motor action to pull the tissue away. So then an accessory signal goes to the brain, but not just a brain blob, the brain stem, reticular activating system in this area here. That receives signals to increase alertness and activate all relevant systems, especially unconscious organ function. The main signal then passes through a relay center called the thalamus. We see right over here. That is a hypothalamus. Right? We'll get to him later. So where the signals are routed throughout the brain, including the hippocampus. So that is a hippo, to remember the event, and the amygdala and cingulate. So amygdala and cingulate here and here. These put emotion like fear and suffering, they put significance on the memory. And smell, well, it feeds straight into the brain without passing through the thalamus filter, linking smell powerfully with many events. The hippocampus logs the experience in the memory. The amygdala works to determine if this is a very serious threat that needs more serious attention with other physical, mental, and emotional or biochemical resources. It and other pathways send signals to the sensory centers of your brain. This is the sensory strip. So you know you felt something, and the motor centers right next to it to yelp or shout with discomfort. So all this time, your frontal lobe receives info from your eyes, your ears, your body signals, other body sensory centers, as well as filtered, colored interpretation from other brain areas that made prejudgments about this experience. So a lot going on. Only then and there do you start consciously understanding and evaluating what happened. This delay is most clear in a small child that experiences a mild physical trauma. If it's a very small child, like an infant, he or she looks to their parent before and if they cry to help them understand how much concern they should attribute to this experience. So pain anatomy is complex, but the solutions are rather simple once you know how to get to the physical, chemical, and/or mental emotional sources to disconnect the pain, which is our topic for next time. Stay tuned. Once chronic pain pathways are neurologically grown and connected, removing or atrophying those and laying down new pathways is the only way to remove the established default reaction to any reinforcing physical, chemical, or mental emotional stimulus flow that easily reactivates pain. So that's what we see over here. So you can think of it, I explained this like a riverbed with an established water flow. We need to dry out the old riverbeds. Okay, so here's our old riverbed. We got the water flow. We need to dry it out and start redirecting the water flow down a new pathway. If we're going to break the pain cycle and disconnect the pain. So a possible but very difficult way is to start with the frontal lobe, part of our brain up here. It's the thinking, planning part of the brain. By choosing not to think about the pain, either with a positive thinking process or distracting yourself with something. So this is like fighting a dragon head on. It's possible, but not the most effective tactic, and usually with very temporary success. Or, using our river analogy, it's like building a dam to stop the water. Right? We put in one piece and another piece, but all the time that the water is flowing, we're trying to put in that dam. So a more effective strategy is addressing more upstream sources. Here in the spinal cord, right? So an analogy would be physical up here in the spinal cord. So in this case, it wouldn't be trauma, right? Physical gravity or movement. So we'll call this physical gravity or movement. So it sends input signals from muscles and joints to actually turn down pain signals heading for the brain. So here we'd have trauma would cause pain. These other signals actually turn it down. So chiropractic, massage, physical therapy, and other coordinated exercises are effective at activating this pain block, especially early in the pain cycle. So another critical area, especially with chronic pain, is the amygdala or cingulate gyrus. So the emotional centers. So that would be our thoughts. So simple techniques to feel renewing emotions can immediately change this flow of the pain cycle. So renewing emotions. And those start to send signals that reinforce this new pathway. So at least some, allowing more comfortable body signals to support the new comfortable flow. If your nutrition, your biochemistry, what we eat, drink, and breathe, so instead of toxicity, we could say eat, drink, breathe, or the chemical. So if you do that in a healthy way, then these new pathways can develop more readily, gradually diminishing the flow of pain and even disconnecting it from the chronic cycle, allowing the new or rediscovered relief or pleasure path to become more active often. So that goes down here, and eventually we have this, and this becomes an atrophied pathway. It's harder to get stuff in there now. This pathway becomes larger. So it's easy in the early stages and possible even in the late stages. So don't wait, take action today. So how can we relax? So there's the good way, the great way, the pretty good way. So we're going to talk about top down, bottom up, and the middle, which is up and down. So that's the best one, but the super best one we're going to teach you later. So this is really good. So top down, what does that mean? Top down is when you try to think about it. Go, you know what? I'm just going to relax. All right, I'm not going to think about that. And maybe you can even shut it off if you watch a CSI or some TV show. It's like, all right, you know what? When I'm doing that, I'm not thinking about anything else, and that's helpful. But it's kind of comes right back to where you were before once that's over, right? What about bottom up? Bottom up, I'm going to teach you that one today, and that's when relaxation breathing exercises. So try this with me. We're going to call it heart breathing. It's a little bit advanced. It's easy, but it's advanced in its effect. It's better than just deep breathing exercises. So here you go. So you're going to focus on your heart and imagine that you are breathing in from in or around your heart, like the air is rushing around your heart, that area of your chest, and then you're going to breathe out of that same area, right? So, and you're going to breathe in a little deeper than normal, comfortably, but a little deeper, maybe 5 seconds in, 5 seconds out, right? So breathe in, 1, 2, 3, 4, 5, in around your heart. Now out from around your heart, 1, 2, 3, 4, 5. So try that a few times. It really is effective, and that's bottom up in that it is using the slowness of the breath to activate your parasympathetic nervous system, that rest, digest, and heal, which then suppresses the stress survival. So while you're doing that and while you're focusing on your heart, you're not focusing on other things. So that is a little bit of that top down as well. Okay, so, and then the middle up, that one's super cool. So we'll show you that one later. That's when you can access both the up and the down from the middle with a really powerful technique. So try this heart focused breathing bottom up today. That was brought to you by Heart Math, a cool program that I use in my office. Have a great day.